Most military retirees think their healthcare comes from one place, either the VA or TRICARE. But the veterans who understand something called the Three Shield strategy are protected in a completely different way. Not long ago, a retired Marine called me completely confused about his healthcare. He had VA coverage, TRICARE, and suddenly someone told him he needed Medicare too. His exact question was something I hear from veterans all the time. Why do I suddenly need three healthcare systems? Let me explain what I mean. Over the years, I've spoken with many veterans who assumed the VA would handle everything after retirement. And to be fair, that sounds logical. You served your country, you earned those benefits. So naturally, you're probably thinking, why would I need anything else? But here's where things get interesting. Because the veterans who navigate retirement healthcare the most smoothly don't rely on one system. They use three. I call this the Three Shield strategy. Three different programs protecting you in different situations. Shield number one, VA healthcare. Shield number two, TRICARE. Shield number three, Medicare. And when these three shields work together properly, they can create one of the most stable healthcare systems available to retirees. But here's the part that surprises many veterans. These shields do not activate automatically. And this is where a lot of people get caught off guard. Let's walk through how this actually works. The first shield is VA healthcare. The VA system is excellent for many veterans, especially for service-connected conditions. Many veterans prefer VA hospitals and clinics because they specialize in military health needs. But the VA system has limitations. You typically must use VA facilities, and access can depend on availability. The second shield is TRICARE. TRICARE gives military retirees and their families access to civilian doctors and hospitals. This adds flexibility. But when you reach age 65, TRICARE changes. And this is where the hidden rule appears. Many veterans believe TRICARE will simply continue the same way forever. But that's not how the system works. Once you become eligible for Medicare, TRICARE requires something very specific. You must enroll in Medicare Part A and Part B. Without Medicare Part B, TRICARE for Life cannot activate. That requirement is what unlocks the third shield. And the third shield is Medicare. Medicare becomes the primary payer. TRICARE for Life becomes the secondary payer. Together, they can cover many of the costs traditional Medicare alone would leave behind. But here's what most veterans never realize until someone explains it. When all three shields work together correctly, VA can provide care through VA facilities, Medicare provides nationwide coverage through civilian providers, and TRICARE for Life helps cover many of the remaining costs. That's the Three Shield strategy. And once you understand how these systems coordinate, retirement healthcare becomes much easier to navigate. If you're a veteran approaching Medicare age, understanding this coordination early can help you avoid one of the most common enrollment mistakes. Because once you see how the three shields fit together, you can't unsee it. As someone who has spent over a decade helping people navigate Medicare and retirement healthcare decisions, I see this confusion all the time. If you're trying to figure out how VA benefits, TRICARE, and Medicare will work together in your situation, you can learn more or reach out to me at RobinsWisdom.com. I'm always happy to help veterans make sense of these decisions before they become costly mistakes.